25 years ago, I was searching for a place to go to nursing school, and somehow I stumbled upon Bryan Memorial Hospital. The area I work on, 7 North, 7 South, the nurses up there, I watch them up there from the techs to the nurses doing their hourly rounding, making sure the patients have all their needs met, the way they treat the family members, making sure they're taken care of. I feel like the people that I work with here, they're really part of my family.
You have to love what you do, and for Bryan, you know, we are all here to do that. I just enjoy seeing that process of where they come in and when they leave from rehab, and seeing that progress that they make through the excellent care that the doctors and nurses provide and are joining back into the world in a healthy state. So enjoying that journey is part of that, seeing our patients succeed.
Overall, we have a really great sense of community here at Bryan, and I think that really shows in the care that we provide to the families and the care that we provide to the patients. I think, you know, how would I want to be treated as a parent up there? How would I want my child cared for if my child was up there? And I try to, you know, to provide that care that I would want my own family to get.
I know in healthcare, we're always dealing with changes. And I know that with each change comes new challenges. We have to give the best quality care that we can, because we are depending on people to come back to us or to spread the word that we are a good place. And I know that when I work with my patients, that after the end of the day, I have given them the best I possibly can.
Things don't go unnoticed. Your contributions really make a difference. When they've been discharged, they'll still call you up and ask you questions because they think of you as the expert or somebody who knows. And it's nice to have that kind of confidence in the patients and their families that work here. And everybody works as a team, and it's like, wow, I really did impact that family.
Bryan has always had a great reputation in the community, not only as a hospital, but as a place to work. I think the thing with my job that gives me the most satisfaction is quite often I run into physician candidates that have left the state of Nebraska, and they're from Nebraska, their home ties are here. They may be left for school, or they might have left for a position, and all of a sudden they find a strong desire to get back to the state. And when I can find a great position for them and find a good match and bring them and their families back home, that is probably the most satisfying.
I think that when you work somewhere, you also need to be involved in the community to show that your organization is interested in the community they serve. Everyone has a different story, and if you can listen and address their story directly, that they feel like they're getting some help. For me, it means really listening to what the patient needs are.
There couldn't be any greater tribute to an organization than when people come in and can really see that their employees are living the values. Since I've been here, I've helped educate over 4,000 students. So that has been the highlight, and then I see them, you know, when I have family members or friends in the hospital, and I'm just always so thrilled and so proud, and you just feel like you've had some small part in that.